we've got a little bit of a bonus episode of the Functional Enough podcast because if you're not watching right now, you can't tell, but I am at my mom's house right now. I'm visiting her from across the country, and we had a really great conversation about my grandma who was schizoaffective and bipolar, and she had the shit shocked out of her brain many a times in the 50s when she was being treated. And electroshock therapy is still used now, but in the 50s, it was often done when the patient was awake, there were no sedatives or anesthesia given, and they were shocking them at like much higher voltages. So it like caused a lot of trauma and pain. And I imagine that like happening to my grandma, and it just like breaks my heart because being bipolar is scary enough. I can't imagine like being in a facility like that during that time and having that happen to me. And she was schizophrenic and bipolar. And like those were the things that they mainly did the shock therapy for. And my grandma ended up developing early onset Alzheimer's. And my mom and I are like convinced that it's because she got shocked so many times and that she was probably never the same because of it. But it is interesting because, bipolar, there's not really one known cause. There's a couple different factors, and guess who has all three? I do. There's some genetic component to it. Hereditary is the big one, and then trauma related. So I've had the trifecta there going for me. And, she was in and out of hospitals when my mom was a kid. Most of my mom's second grade, she said, like, she spent mostly in the hospital. She remembers her being either manic or in a hospital, like, not much in between. And, there are differences in how they were giving medications. Like, lithium was still around, so she was on lithium, but were they doing regular tox screens to make sure she wasn't getting lithium toxicity? Who knows? Was she on the right dose? Did the lithium even work for her? Because lithium doesn't work for everybody. And were there other options out there for people with bipolar in the 50s? Or was lithium their only option? She also was prescribed Halidol. I used to work in healthcare, and Halidol was given to sedate people. So it's like she's either in a state of sedation or a state of maybe discomfort from the medication or still in mania because the medication's not working. And that's just not a way to live. And that's not how I think anybody that has these disorders wants to live. I certainly don't. And there's also a big stigma around bipolar and mental health back then. Women could get thrown into psych wards for being hysterical. I don't know when they stopped doing lobotomies, but like I would have been lobotomized if, this were that time frame. But there was this big stigma around it, and there still is when it comes to bipolar. People still don't quite understand what it's really like. Our moods don't change on the flip of a dime. If something upsetting happens, I'm going to be upset. I experience emotions just like a normal person. I just have a problem with the gas to the brake pedals in my brain. So I've got the high highs, and then it's kind of a big crash down with very little brakes happening. And it's all these different things happening inside my brain that are outside of my control. But I, was asking my mom more questions about my grandma and like about like what it was kind of like growing up with her. And I felt so bad for my mom because I was like, well, did you feel like you could go to her like when she was okay? Because I was like, well, did she have times where she was like stable? And she's like, well, yeah. I'm like, okay, so like did you feel like you could go to her as a mom, like emotionally present, physically present? Oh no. Like if my mom wanted something from her mom, it was like, wait till my grandpa gets home and ask him, because she just like got overwhelmed and couldn't handle it. My grandpa would give her money to buy groceries, and she would go and buy a bunch of random useless things. She bought a bunch of fabric to like make dresses out of that she had no idea how to do, but decided she was going to try to do it. And I'm like, that sounds like me when I try to crochet for about half a second. But she was an impulsive spender. I'm not so much of an impulsive spender. My finances aren't great, but I'm not like a huge shopper. I don't like waste like money necessarily. So that was like kind of a difference between like how it shows up for us. She would hallucinate, forget who she was. She would go out and wander around, and my grandpa would have to ride around town and look for her and pick up Adeline off the street because she wandered off again. And like, I've never done that to my knowledge. Maybe if I sleptwalk, but I don't know. As far as I know, I don't wander around unsupervised. Our cycles also were a little bit different. So like, per my mom, it seemed like my grandma cycled like every couple months. Whereas for me, it's like every like 3 weeks, 2 to 3 weeks, I feel like. I have like, you know, a little bit of hypomania. I haven't gone like full manic since I've been on meds, but then I go into like a mixed state and then depression, and then I kind of start my cycle over again. But it's about like 2 weeks in each phase. Some people it's a month, some people it's years. It just depends. And that's the uniqueness of bipolar disorder. And that's why it could be so hard to treat, because it's not a one-size-fits-all treatment. You know, my journey and my experiences, you know, my symptoms, my meds are going to be different than yours, that are different from my grandma's, even though we have the same condition. And then I did ask, like, if she ever seemed happy, you know, because I'm like, well, like, I want to be happy as someone that has bipolar disorder. Like, I don't want to live my life either, you know, so zombied out for medications or sedated or manic. And she's like, yeah, like, we go camping and, like, that would make her happy. And I'm like, I think we would have gotten along great. I wish I got to meet my grandma, because I would have loved to go camping with her, because I also enjoy camping. Like, that's a place for me to, like, relax, be in solitude, and is like one of my happy places. But it was like she was never fully present emotionally, and it was like she wasn't the same. She was a little more flat and dull, but again, like, that could have been all the shocks, it could have been the medication, or the medication just wasn't working for her and she just was experiencing the normal cycles of bipolar. My mom had memories of like clinging onto her bed, like not wanting to go to school because she didn't want to miss mom coming home, because she was so scared that, you know, she would leave her school one day and then she would come back home and my grandma would be back in the hospital. My mom showed me like this really cute little like mug that my grandma made when she was in the hospital, and it's like, oh great, they had arts and crafts in between each electroshock session. But it was really cute. And, you know, like, I've seen pictures of my grandma and, like, her smiling, and it's like she's beautiful and, like, she seems so happy in the picture. But it's like, I have a different understanding now of her as a person, because she passed when I was really young. And, you know, I can't imagine how hard and lonely and how scary that must have been, like, for her. And especially because, you know, we know so much more now about bipolar disorder and how to manage it than they did back then. And, you know, my grandpa also was doing his best to try to manage it. He had 4 kids to take care of. You know, he was the sole earner of the house. He had to make sure she had her meds, had to make sure she was in the hospital if that's what she needed, had to go look for her around town if she wandered, and that's a lot to put on somebody. You know, like, my partner, I feel like puts up with enough from me, you know, like, I can't even imagine if I had to add all that onto it too. But, you know, and I asked my mom's opinion of, like, you know, if she really worries about me because I have bipolar. And I think she's a little bit more worried than she lets on. Just because, you know, she is also aware that bipolar does have one of the top, like, suicide rates of all mental illnesses. And, like, I swore to her that if I ever had those thoughts, like, I would tell her. I'm a very self-aware person, so, like, if I start having thoughts, like, I have no problem, like, communicating to my support system, like, I'm having these thoughts, I'm not okay. I know that's hard for some people, but you're not bothering anybody. Like, I don't care what time of night it is, whoever your support system is, if you're having thoughts like that or you're in a dark place, you call your people, because they would rather take that call in the middle of the night than find out later that they don't have a friend anymore, and that you're gone. So, you know, just bother your friends, because you're not a bother, okay? And I guarantee you they're not going to see it that way either. But so I asked her if she was worried about it, and basically, like, seeing like how bad it can get and wondering if that's going to be like my future. Is like, I'm only 27 right now, you know, and I'm younger than my grandma, I think, when she was starting to get treatment. And it's like, I wonder, like, am I going to be emotionally present if I have children? Am I going to be able to handle, being a mother? Am I going to be, emotionally distant? Am I going to be hospitalized? Like, because, what's working for me right now might not work for me 10 years from now. Like I might be on the same medications for a long time and then suddenly they stop working for me, or I start having bad side effects and we have to switch things up. And, the other thing is like my mom worrying about me is like she has to trust that I am being honest about, where I'm at, how I'm feeling, and that I'm caring for myself. And like I have like a contingency plan. Like I have like a green zone, a yellow zone, and a red zone. Green zone is like there might be some hypomania signs, but we caught them. I'm still functioning. I'm still sleeping, eating, like doing my normal routines, taking meds, like all is well. Yellow is like we're starting to get into territory of like I'm not showering, I'm not eating, I'm not like present essentially. And then red is like we page my doctor's like emergency like line because like I need help like immediately. So it's like, having those plans in place, having a support system, having people you can go to and say, hey, like I'm having these thoughts. But, part of that trust on my mom has to like, she has to trust me that like, I'm trying to get myself to a point where I never have to make her worry that she is gonna lose me in any way. Because like I'll be damned if I let this disorder like take control over my entire life. Like it's already changed my life entirely. I've had to leave 2 jobs because of it, having a hard time finding another one because of it. I financially like took a hit because I had to put things on credit cards when I wasn't working. It changed my life, but I just have to adjust my expectations. I had a vision for what I thought my life was going to look like, and I had to realize that, it's going to look different, but that doesn't mean it's going to be bad. And I think I have more tools than like maybe my grandma had to be able to handle it, and a support system, and not a society that stigmatizes people who are mentally ill the way they did back in the 50s. People are much more willing to talk about it and be open about their mental health. I'm out here talking about it because like I think more people should. And because bipolar can feel so isolating, because yes, we all have the same diagnosis, but again, it is so different, whether it's your symptoms, how you cycle, your meds, to where it feels really isolating and it feels like no one understands. But if anything, like, if you don't have a support system, message me, comment, email me at functionalenough.submit, like whatever you want to do. Like I am all ears all the time for anyone that needs it, because I've been in that spot of like just needing someone to listen, and I'll always be that person for anyone that needs it, because that could be a difference of somebody being here or not being here, and I take that very seriously. Let's see what else. I have my notes here. I have also will forget to say things if I don't write things down. Talked about cycles. Yeah, I think that was pretty much it. It was kind of a shorter episode, but it was kind of like a bonus one because I didn't really like answer questions. It was more just stories about my grandma that I thought were just super interesting because I never knew her. I just knew that she was really mentally ill, and it never occurred to me that I was going to acquire said mental illness. And now that I have, learning about her and her life, and if she was happy, if she was stable. And I try not to let it scare me, because I do know that it is a lot different now than it was back then. No one is going to be shocking me without any sedation anyway. It's not as stigmatized. I can talk about it. I'm not going to be, ostracized for being open about my mental health. And if you are the kind of person that is hard on people that are open about their mental health, it's not easy to do, and it helps people, and that's why I do it. And it also helps me. If you don't like it, you don't have to watch it. So anyway, there is a little bit of a bonus episode. I am releasing episodes on Wednesdays normally, but I'm gonna go ahead and upload this one today. which I think it's the 6th. I don't even know what day it is. But normally it's going to be on Wednesdays. So I will have episode 6 out for you guys on Wednesday. And yeah, if you're on YouTube, thanks for watching. If you're on Apple Podcast or Spotify, thanks for listening. And I will see you guys next time.